Let's talk about bladder health. Emptying the bladder regularly is part of a healthy kidney function. Regulating urination requires adequate and consistent hydration, properly functioning pelvic floor, and good toileting habits. Three of the most common bladder problems are urinary urgency, frequency, and incontinence, aka leakage. And in order to optimize bladder function, it is important to understand what is considered normal for the urinary system. Here is a chart about bladder norms. There are three phases of healthy bladder function: the storage phase, the transition phase, and the emptying phase. The bladder is a muscle. It's called the detrusor muscle and relaxes to allow filling. The pelvic floor muscles are semi-contracted to prevent leakage. So when the bladder talks to you, the detrusor muscle is actually contracting, and you'll feel pressure in your lower belly. So the bladder stretches as it fills, which sends several signals to the brain. The first signal is for the first sensation to void. This is when your bladder is 40% full, about 5 to 7 ounces. The bladder initially stretches to accommodate urine, and sphincters reflexively keep the urethra closed. So anytime you get the first signal to pee and you start rushing to the toilet, you're training your bladder to not have to fill at all. The second signal is the first desire to void. This is when your bladder is about 75% full, or 6 to 10 ounces of fluid. The pelvic floor muscles contract voluntarily to inhibit the detrusor until it is time to void. And then the third signal, this is the strong desire to void. This is when your bladder is more than 75% full, or about 11 to 18 ounces of fluid. The brain perceives this as a strong urge to void. And then there's emptying. The bladder, which is the detrusor muscle, contracts to push the urine out, and the pelvic floor muscles relax to allow emptying. Some volumes. The maximum bladder capacity is between 15 to 19 ounces, depending on the person and how well they've trained their bladder to expand. Normal output per void is between 10 to 15 ounces. And post-void residual, this is less than 1.6 ounces. And what the post-void residual means is that your bladder will never be completely empty. There will always be some fluid left in your bladder. Voiding patterns. 5 to 8 times per day, or every 3 to 4 hours, is the number of times you should be voiding per day. At night, 0 to 1 time at night, depending on the person, usually on age. If you're over 70, we allow you 1 time at night. And then 8 to 10 seconds per void is a steady stream. This last point on here, I like to really highlight: adequate water intake, or about 70 ounces per day, or half of your body weight equals number of ounces per day. You want to stay hydrated. A lot of my patients come in and say, the more water I drink, the more I have to pee. Well, then I have to tell them it does take 4 to 6 hours to digest water. Your water is going to be hydrating all the cells in your body and going to all your organs. It doesn't go straight to your bladder. Drinking water does stimulate digestion, and sometimes we get confused about what the signals our body's giving us. But the bladder is just a muscle. And the more toxins in your bladder and the less water, the more irritated your bladder will be. So your bladder will talk to you more. So it's your job to dilute the bladder with more water. Good habits to maintain bladder health. The do's and the don'ts. Do maintain good fluid intake throughout the day. Space it out and stop 2 hours before bed. Limit bladder irritants. We'll go over those on the next slide. Minimize constipation. So you want to keep the poop flowing. Practice pelvic floor muscle strengthening and relaxing. Allow adequate time to fully empty. Don'ts. Don't drink fluids all at once. Avoid consistently ignoring the urge to urinate for longer than 4 hours. Avoid preventative voiding or going just in case. This is an increase for urgency. Avoid hovering over the toilet. Please do sit down. Avoid rushing and straining to empty. Your bladder lives on the autonomic nervous system. So the more anxiety you have about having to pee and the more you rush, the more it talks to you. It gets excited. It makes you have to pee more. So we want to limit that anxiety and calmly walk to the toilet. Some bladder irritants. So here are the most common ones: caffeine, tea, caffeinated soda, carbonated beverages, alcohol, medicines with caffeine, chocolate, smoking. And here are some that might irritate some people and not others: milk and milk products, aspartame, so artificial sweeteners, citrus, fruits and juices, tomato and tomato-based products, spicy foods, sugar, honey, corn syrup. I know, I like some of these things on the don't list too. And we're not saying to cut them out of your life forever, but if you are avoiding a lot, you want to eliminate them for a short period of time and slowly add them back in, especially as you increase your water intake. I tell my patients, you want to drink your cup of coffee? Add another glass of water. You just got to dilute those toxins in your bladder. Training for the bladder, or AKA bladder retraining. Urge suppression. So the number one on this list is be still. Rushing will stimulate the nervous system and increase urgency. So sit down if you're standing. Lean up against the wall if you're walking. You want to calm your nervous system. Number 2, quick flicks. Squeeze and release the pelvic floor muscles quickly, 3 to 5 times in a row. This signals the bladder muscle to relax. You'll go over quick flicks in more detail in your sessions with your physical therapist. Deep breathing. Take a slow, deep breath. Inhale through your nose and exhale through your mouth. Focus on your breathing. This will calm your autonomic nervous system. And number 4, distraction. You can try counting backwards from 100 by sevens. You can tell yourself you're in control and you got this and you just peed an hour ago and you know that you can hold it. Or get immersed in a project that you're doing. Ignore your bladder. Daytime training. Set weekly goal. For example, to void every 1.5 hours. Use urge suppression techniques. Find the one that works for you and apply it, especially in those times when you really have to pee. Continue to practice suppressing for longer intervals after 3 to 4 days, successfully meeting your first goal. So you want to lengthen the time. So if your goal was an hour and a half, eventually you want to be able to hold it for 4 hours. Utilize a timer system to remind yourself to check in with the bladder, hydrate, and void if necessary. Start timer at every 60 minutes and work your way up to longer intervals. Nighttime training. Set a goal for the week. So you want to only wake up 1 time a night. Stop drinking 2 hours prior to bedtime. Use urge suppression techniques at the first sensation. Turn sides or change positions to reset or stretch bladder. And utilize breathing exercises to distract yourself and fall back to sleep. By all means, if you can't fall back to sleep, please get up and go to the bathroom.